Hello, everybody. Welcome to the first of our Industry Insights podcasts. I'm delighted today that we're kicking off talking about Ben, our industry charity. Some of you may know that it's my great privilege to be chairman of Ben. And if we could have the next slide, please. I think you know who I am. I hope you do anyway. I'm Steve Nash, Chief Executive Officer of the IMI, but it's fantastic that today we have Rachel Clift with us, who's the Health and Wellbeing Director of Ben. Welcome, Rachel. Great to see you. Maybe the first thing we could do, and if we could have the next slide, please, which I think talks about Ben, but just for people's clarity, Rachel, Ben has essentially two divisions to it, doesn't it? It has a care division and a health and wellbeing division. So do you just want to give us a very, very quick sort of potted view on what the difference is between those two things?
Of course, yeah, thanks, Steve. Firstly, I do feel like it's important for me to say a big thank you to you, Steve, as our chairman, and also to the IMI for your ongoing support. It's incredibly important to us and the work that we deliver at Ben, so we can't thank you enough. Just by way of introduction to myself, so my name is Rachel Clift. I'm the Health and Wellbeing Director at Ben. I've been working for Ben for just under 2 years, and my role was appointed to help develop and transform our health and wellbeing service offering. So for anyone that isn't aware of Ben, Ben is the automotive industry charity providing support for life for its people and also family dependents. We were founded in 1905, before the welfare system even existed. So historically, Ben was a benevolent charity that people could seek financial support for. But today, as you rightly say, Steve, Ben has 3 different services. We deliver our care services across 3 sites in the North, the Midlands, and also at our Linwood site in Ascot. Our retirement village also located at our Linwood site in Ascot. And of course, our health and wellbeing services, which covers the whole of the UK and Northern Ireland, providing a range of different health and wellbeing support for people of the industry. And so that's what I'm here to talk to you a little bit more about today.
That's fantastic, Rachel. And of course, you're a healthcare professional for some time and an ex-Olympian as well.
That's very true. It feels like a sort of former life. Yeah, so I was a former Great Britain and England hockey player. I retired just after the Beijing Olympics, and fortunately for me, I was able to continue to work, and I'm a physiotherapist by degree, by background, and actually worked a lot in sort of health and wellbeing, workplace health and wellbeing, and a lot in the space of where we're trying to get people back into the workplace where they are long-term unemployed. So delivering health and wellbeing programs to help people to return to work and then stay in work.
So tell us a bit. So I mean, from my perspective, and I'm sure you'll correct me if I'm wrong, because your definition will be better than mine. But I would sort of define the health and wellbeing side as being the part of Ben's services which engages primarily with people in work. So the active workforce today. But perhaps you can tell us a bit more about Ben's health and wellbeing services and what that involves.
Yeah, absolutely. I mean, you do touch on a really poignant point. We do see a large proportion of people come through our services that are still employed in the industry today. But clearly we do provide support for life. So that could include someone that no longer works in the industry or has even retired from the industry. So, but no, I think what would be really helpful maybe is to look at the different ways in which we deliver our health and wellbeing services. So we have online support. We also deliver a helpline, a support service. We have our specialist services and a sort of small training arm called Ben Training. What I thought might be quite helpful is to sort of just talk through very briefly each of those areas to give you a bit of a feel for how we do that. So our online support is provided via our website. Individuals can also sign up to our emails offering what we call health and wellbeing tips, advice and tools, which are sent straight to their email inboxes. We also have several online support journeys which can be accessed via our health and wellbeing pages on our website. And most recently, we've included a development of a coronavirus hub and specific content related to health, work and wellbeing. And that's really been in response to current uncertainty around the industry, but also helping those that are being affected by job losses. Moving on to our helpline, well, our helpline continues to operate 8 a.m. to 8 p.m. Monday to Friday, and we manage inquiries via web chat, telephone, and also by email. Our helpline advisors are essentially the first point of human contact, offering what we call an information, advice and guidance. They manage a number of crisis calls, and they also themselves administer our urgent need grants. Our support service has dedicated case managers who provide comprehensive needs assessments, case management. They also offer information, advice and guidance, as well as the administration of both our welfare and what we call special consideration grants. Our case manager I would consider to be skilled in benefits counselling, money management and supporting general financial literacy, but they now also provide employability support to help individuals who might need assistance with building a CV, job seeking, interview skills, as well as tackling issues with confidence and motivation, which are commonly affected by people affected by job losses. A couple of other areas. So our specialist services host Ben's mental health pathway, providing support for mental health and wellbeing through what we call a stepped care model. So helping people to have more informed choice about how they receive support for their health and wellbeing. And we have a digital support platform that sits within our stepped care model called Silver Cloud, which provides computerized cognitive behavioral therapy. So individuals can access a range of programs which are around 12 weeks in duration via what we call a supported and unsupported route. And programs include things like managing depression, anxiety, building personal resilience, and coping with change and mindfulness. We absolutely continue to provide telephone and face-to-face counselling, talking therapies, and other specialist interventions for trauma, relationship and family therapy. And we have a small team of life coaches who deliver a 6 to 8 week programme telephone-based service for individuals wishing to make positive change in their life, or simply supporting individuals through a period of change or uncertainty. So certainly very poignant in the times that we face currently. Final area, sorry, Steve, you're going to say something.
No, I just said, no, I was just agreeing with you. I mean, yeah, carry on. Sorry, I didn't mean to interrupt your flow.
Not at all, no, that's fine. So the final area I just wanted to touch upon really was the training that we deliver. And of course, we were delivering training face-to-face, and we're not in a position to move to anything virtual particularly quickly. So we're in the process at the moment of developing shorter, more focused, practical, what we're calling resilience workshops, each having sort of top tips for people to take away. And what we're trying to do is focus on the topic areas related to what we're seeing coming through our helpline, through our support and specialist services, as well as what individuals are reaching out to support on the website, so the content that they're viewing. And currently, just to give you a bit of a flavour for what those topic areas are, we're thinking about managing your mood, coping with anxiety, stress and pressure, energy and sleep, and fueling your well-being.
That is an incredible list of things that you went through, and I suspect that most people don't have any idea quite how broad that support and offering is, and I think it's really good to be able to spell it out. I mean, I know that we as an organisation use your services. I mean, you know, we direct our staff to you, and I know that, you know, without giving away any confidentiality, because this is all confidential, isn't it? I mean, I think a lot of employers wouldn't know necessarily that their staff are being helped by Ben, because of course you work in confidence, but where people are willing to share, you'll be pleased to hear actually only recently, in fact this very week, I got an email from a gentleman from a large organisation in the sector, who was saying, you know, that some of his staff had shared with him the help they'd had from Ben, and he was just saying what a fantastic job that Ben had done. So I think that's brilliant, and I can tell you that he and I are still committed to making a parachute jump, a sponsored parachute jump, to raise some money for Ben when social distancing allows. But yeah, I think it's fantastic work, and you know, I mean, tell me, I mean, you kind of touched on the current circumstances, but what can you tell us about the challenges that are being faced by those who are reaching out for Ben's support right now?
Yeah, I mean, I think it's been really, really interesting observing and watching service demand in the last 2 years that I've been working at Ben, for one, but also what's happened this year as well. So absolutely, we've got quite a bit to share with you, really. So in the last 12 months alone, we've seen a 90% uplift in helpline inquiries, so people reaching out to our helpline, and we've actually supported 50% more cases. And earlier this year, before the pandemic, around 50% of individuals were seeking support for what we would call a sort of mental health issue alone, and 40% were reaching out to us for solely financial support. And actually, what's been really interesting over the course of this year is just how much that's changing. So we're seeing the number of people reaching out to us financial advice and guidance growing as we make our way through this year. And since April so far, we've also seen a 58% increase in people requiring what we call urgent need, which sadly, and it's a bit stark, means people not being able to put food on the table. So really sort of basic needs, and that's a trend that appears to be growing for us. And I think we're expecting that to continue through the next 6 to 12 months, essentially. But
I guess, Rachel, I mean, most people didn't kind of expect things to drag on as long as they have, but with people looking at a sort of at least another sort of 5-6 months, and who knows what happens after that, I guess that adds to the pressure, doesn't it?
What, absolutely. And I think that's why we will continue to be supporting people, not just financially as that grows, but clearly around mental health in particular. And for some time, we've been experiencing an increase in the number of people turning to us for their mental health. And COVID has certainly heightened the situation, with some individuals coming to us feeling more stressed, anxious, but also lonely and isolated. That's been quite a considerable factor. I mean, year to date, just under 40% of those referred for what we call further mental health support through our pathway reported that their symptoms had either been brought on or made worse by the pandemic. And I suppose what our insights are telling us is that anxiety levels have increased, and we think that's a lot to do with the uncertainty about the future more generally, but it's leading to issues with sleep, increased food and alcohol consumption, which both of those things coupled with feeling less socially connected is affecting people's mood and leading to feelings of depression. So whilst anxiety continues to be a significant issue, and we believe that's related to job security, but just the general uncertainty about the future, one of our most recent insights survey indicated that people are saying that staying positive, motivated and resilient was actually one of their biggest challenges.
Yeah, it's understandable, I guess, isn't it? As I say, I've definitely noticed in general, talking to people, not just within the IMI, but outside as well, that there's been a gradual building of that kind of pressure since people understood that this could be going on for another 6 months or possibly even longer, if nobody quite feels that sort of confidence that this is all going to end suddenly, anymore, and that's a real issue, isn't it?
Yeah, it really is. I think uncertainty, different people cope in different ways with uncertainty, and I think we're all on quite a steep learning curve about adapting to change and coping with when through uncertain and challenging times. But that's what Ben's there for as well, and I really want the industry and its people to consider us as part of their support network. So if they don't feel like they have that in their own kind of social circles, and the quality of the relationships is so important, then we're here. Pick up the phone, get in touch.
Yeah, and I guess the reality is, in many cases, if people have got quite personal issues, then the reality is they're not always going to feel comfortable about going to their own HR department, if indeed they have one.
Yeah, no, absolutely. And I think just alluding to the point that you made earlier about employers, it is a confidential, independent service away from the employer. But actually, employers do make up quite a large proportion of referrals coming in. So people might have an initial conversation with a manager or with somebody in HR, and an employer can refer somebody into Ben. And what we would do is, if work is presenting an issue or there's something that needs to be addressed around work, we try to empower individuals through the service that we provide to have those conversations with their employer directly, because our role is not to directly communicate with employers, but we want to improve the confidence of those individuals to do that themselves.
Right, yeah, no, I understand that. And what can people do to help manage their own mental health and well-being?
Well, I think it's a really difficult question to answer specifically for anyone, because what might work for one may not work for another. But if I was to think about giving sort of 3 top tips to help us to better manage our mental health and well-being, I'd probably go for taking care of your physical health, seeking quality relationships, and taking some time out for you. So if I take those sort of individually, by taking care of your physical health, I suppose it's the analogy of, we all have mental health in the same way as we have physical health. And because they interact with each other all of the time, by taking the time to look after your physical health through eating well, keeping ourselves hydrated, keeping more active, and working on a good sleep routine, it's a really great place to start to help to improve your mental health. And then there's this whole bit around good quality relationships where you feel like you have people to talk to so you can share how you're feeling. And I think knowing you have this is really comforting. But even if it's just for a listening ear, having that ability to turn to somebody when things aren't going quite so well is incredibly important. And my final point about taking time for you, I'm really passionate about asking people or getting people to take part in activities that they really enjoy, that it actually gives some sort of meaning and fulfillment. So it could be playing sport, reading, it could even be spending quality time with your family, singing, playing a musical instrument, whatever it is that you find sort of pleasurable and enjoyable, where time sort of just passes by without you even knowing. It absolutely has a positive effect on your mind, and it's a really good way to distract us away from sort of day-to-day pressures.
I guess, Rachel, I mean, one of the downsides of this sort of extended home working is getting proper demarcation between work and private life, isn't it, really? It's far too easy for people to drift into sort of never really kind of having a defined start or finish time, isn't it?
It is. I think that is a real challenge, and I personally, have faced that challenge, as I'm sure you do too. Yeah, it's just not easy, and you have to put your own boundaries around yourself, your time, because if you don't, the lines can get blurred very easily, and you could find yourself just working and working and working. And I think the most important thing to remember about that is we become less productive. So the longer we work doesn't necessarily mean that we're working harder, because we're not necessarily as fresh or as productive. So having clear boundaries about our working day. And there's some research that suggests that home workers really benefit from almost imitating a commute. So by maybe walking around the block, walking into the front door, shutting the front door, and that's right, I'm in work now. And similarly replicating that same at the end of the day.
Yeah, absolutely. Well, listen, I mean, I'm only too aware through my engagement with Ben that I think people should be aware that all charities are suffering in the current climate because fundraising activities have largely stopped, haven't they? I mean, the sort of thing. But I'm always conscious of the fact, or I'm always keen to point out to people that Ben is a specialist industry charity, so therefore we can't rattle tins on street corners and expect donations or anything like that. So we only have one source of income, and that's from the industry itself, isn't it? So how can the industry support Ben?
Yeah, so you're absolutely right. Our health and wellbeing services are funded by our fundraising activities, and like many other charities this year, we're facing at least a 1 million, if not more, shortfall in income this year. So I suppose all we can ask at this stage is for you to help us to continue to provide vital health and wellbeing support to those that are going through what we would consider as some of life's toughest challenges. I mean, there are several ways in which you can support Ben. Clearly, the events world is a closed shop at the moment, but we're running lots of virtual challenge events that people can get involved with. You can make a one-off donation or a regular donation. And I have to say, we have got some new and exciting fundraising things around the corner, about to be introduced very soon. And of course, Christmas is looming. And we'll absolutely be launching some new Christmas themed events and activities for people to get involved with too.
Yeah, and of course this can link to personal health and well-being as well, can't it? You know, if you get involved in something, and I'm always conscious of the fact there's nothing that's too small, really, is there? I mean, it could be little and often, you know, that people make contributions, and I know that a number of our team have been doing our IMI 100 challenge and have been out walking, riding, you know, various ways of covering a distance to raise money. But no, I think that's really important, isn't it? And I'm ever conscious of the fact that those fantastic services that the charity provides have to be funded somewhere, and can only come from the industry. So, you know, I definitely join you in encouraging anybody who can to do their bit, you know, however small, to just keep the funds coming into Ben, so that we can do more for more people.
Absolutely. I think you've probably wrapped it all up in a nutshell. You know, we get some amazing, incredible feedback. It's quite overwhelming on a regular basis, coming directly, you know, through email, people writing to us to say thank you. It's been life-changing. I don't know what I would have done without you. So we are making a significant difference, but we can only continue to do that with the right funds in place.
No, that's Rachel. That was really brilliant, really good, and you know, I can only say, you know, I think on behalf of the industry, you know, what a great job the team do, and how much it is appreciated by so many people. So, and thank you for giving a really clear explanation around all of those elements of what you do. So thank you for that, and thank you for being our first podcast star.
Oh, well, thank you for having me.
Delighted, and what I would say, there are some links here that will help you kind of find out more, enable you to get in touch with Ben, and just, you know, to do your bit where you can. And so I'll just say thank you again, Rachel, and we look forward to catching up with you next time for our next podcast.